Now, looking at the use of yoga for anxiety in the general population, it is being used by individuals in the general population to help with anxiety, and this appears in media articles. This is from a well-known Western news magazine, Newsweek. Coping with anxiety. Science shows that meditation, massage, yoga, even laughter can change bad habits in the brain. The whole idea that yoga has some efficacy for anxiety. In fact, there are now a number of books that have been published. This one on yoga for anxiety, this one on yoga therapy for anxiety. This is a more recent book. This is combining yoga with cognitive behavioral therapy for anxiety by my colleague Manjit Kaur Khalsa. And then we see that the research evidence starts to get into other publications. This is actually by Harvard Medical School. This is a special health report entitled An Introduction to Yoga. And in this book is the summary of all of the research evidence that has been done, plus recommendations for how individuals can engage in a yoga practice. And within this book, of course, is a description of some of the evidence that's been published on yoga for anxiety. And if you go onto the Harvard Health Publishing website, you will see articles on yoga and the science. And so this particular article on yoga for anxiety and depression. Research suggests that this practice modulates the stress response. And so this kind of public promotion of yoga and the research on yoga can affect the general population directly. We also see that many different yoga sites will include information on yoga for anxiety. So this is the well-known Yoga Journal, very popular magazine read by yoga practitioners. And if you go onto their pages, you'll find a whole slew of articles and asanas and practices that are recommended on yoga for anxiety. So now let's turn our attention to the research on yoga for anxiety. What is the evidence that we are now starting to have for this? And the evidence, again, follows this trend from sort of the weaker research to the stronger research. So this is a survey study, a retrospective survey study that compares yoga practitioners with non-yoga practitioners. And they were looking at scores on the profile of mood states. And what you can see is that in the long-term yoga group practice, the scores of mood disturbance is much less than in the control group that did not practice yoga. But when you look specifically at the scores in anxiety, there's statistically significant difference that the yoga practitioners are reporting less anxiety than those that do not practice yoga. This is from a survey in Australia and looking at a survey of yoga practitioners. While 58.4% of respondents gave reduced stress or anxiety as a reason for starting, 79.4% found this to be a reason for continuing. So despite the fact that only 58% started because of stress and anxiety, 80% actually, after practicing yoga, found this to be a strong reason for continuing the yoga practice. Of those who reported using yoga for a specific health or medical condition, more people used yoga to address stress management and anxiety than for back, neck, or shoulder problems, suggesting that mental health may be the primary health-related motivation. Again, this is preliminary supporting evidence of the role of yoga for mental health and anxiety. And again, this most recent publication by Tina Cartwright at Westminster University in London, published last year, looked at the perceived helpfulness of a number of different issues. And what you can see is that stress leads this. 98.4% of yoga practitioners found yoga to be helpful for stress. This is followed by anxiety itself at 96.8%, and then by depression, 93.2% found this helpful. And then high scores for sleep issues as well. Now, the summaries of the research in terms of the review papers and systematic reviews. This is a review that was published early on, concluding that nearly all studies indicated reduced anxiety after a yoga intervention. And this was looking at studies involving yoga for children and adolescents. This was published in 2015. This is in 2016 by my colleague Stefan Hoffman, looking at the effect of Hatha Yoga on anxiety. This was a meta-analysis. Their conclusion was that Hatha Yoga is a promising method for treating anxiety. And then more recently, Holger Kramer, based in Germany, published this systematic review and meta-analysis of RCTs on yoga for anxiety. And this is the forest plot. Everything that's shown to the left of this vertical zero line shows that the intervention, the yoga intervention, was favored over the control intervention, showing positive efficacy of yoga for anxiety. Now, looking at individual studies that have been done, this is a preliminary trial. This is this phase 1 type of trial, a single group trial that was looked at specifically. This was conducted in Toronto in Canada. And they looked at a yoga intervention for patients with generalized anxiety disorder. And what you can see is statistically significant improvements on 2 key anxiety measures on the Hamilton Anxiety Scale, on Beck Anxiety Inventory, showing statistically significant improvements on the Hamilton, which is the gold standard outcome measure, and a strong trend for the Beck Anxiety Inventory. This is a more recent trial just published last year by my colleague Suzanne Danhauer and her colleagues. And what they looked at here was a comparison of yoga versus cognitive behavioral therapy. Again, this very powerful form of psychotherapy. And what they looked at was anxiety in the elderly. They looked at scores of worry and scores of anxiety. And what you can see is that the scores, the change from baseline, is very similar between cognitive behavioral therapy, or CBT, and yoga for both worry and for anxiety, suggesting that yoga is working just as well as the premier form of behavioral treatment for anxiety in the elderly. And then our colleagues at NIMHANS, who are presenters at this conference, Drs. Varambali and Gangadhar, are developing a module of yoga for the treatment of anxiety, and this is their publication this year, looking at a preliminary single group trial showing reductions in the Hamilton Anxiety Rating after 10 sessions, and then 4 weeks later, maintenance of the improvements that they've seen, and then also another measure of generalized anxiety disorder showing reductions. And that's also associated with some improvements in sleep and self-efficacy, holistic health, and disability. Now, I want to sort of finish off this sort of discussion with an example of the evolution of research on yoga for anxiety. And the example I'm going to use is the work that's been done in my laboratory with respect to anxiety and anxiety disorders. Our first work with anxiety happened with a relationship that was developed with the Kripalu Center for Yoga and Health in Western Massachusetts, which is the largest yoga center in the United States. And they are very close to a major well-known music institute called the Tanglewood Music Center. And our focus here was to try and see if we could improve music performance with yoga practice. Well, what we found was that the issue that was very important for musicians is performance anxiety or stage fright. If musicians cannot deal with performance anxiety, their career is at stake. And we found through our research with these young adult musicians that solo music performance anxiety was reduced. This is the black bar, the yoga intervention. Music performance anxiety and the solo performance condition was reduced compared to a control group that did not practice yoga, suggesting that yoga has this direct effect on what is essentially a form of social anxiety disorder. We followed this up with a study in adolescents that were working at this Music Institute. And again, we found that solo music performance anxiety had a significant reduction after the 6-week yoga intervention, whereas the control group that did not practice yoga did not have similar kinds of improvements. There's actually a questionnaire called the Music Performance Anxiety Inventory for adolescents On the total scores, we can see the yoga group showing a nice statistically significant reduction. And in terms of summative and cognitive impairment, we can see the yoga group showing improvement. And then in terms of performance itself, we can see the yoga group showing an improvement as well. Now, unfortunately, we tried to get grants to continue this work, to continue the funding for this work of a form of social anxiety disorder, but we were unsuccessful in getting funding for this. So this is another challenge that we face in the field of research on yoga for mental health conditions. We were funded for a trial of yoga for post-traumatic stress disorder, and this was actually through the Department of Defense in the United States, because the prevalence of PTSD in former servicemen is very high. And this was a study actually done in Canada in the general population. Not only did we show improvements in post-traumatic stress disorder, but the scores of anxiety themselves was reduced. This is the yoga group here in the black bar showing reduction at mid-treatment and at post-treatment compared to the control group, which did not have equivalent reductions in anxiety. We've also done studies in yoga in public school settings and looked at a number of mental health characteristics. And one of the mental health characteristics we see by offering yoga to children in schools is an improvement in anxiety itself. And here's the anxiety scores. You can see the anxiety scores showing an improvement in the yoga group, but a remarkable deterioration in the control group. And this is actually endemic of what's happening in our schools. Our schools are seeing this deterioration, this worsening of mental health characteristics across the semester. And yoga is acting as preventive medicine in preventing this decline in mental health. And anxiety tends to be one thing that is really notable. In fact, we can even look at the qualitative studies we've done with a lot of these public school students. And the quotes really indicate their perceived benefit with respect to yoga for things like anxiety and stress. One student said, if you had a lot of stuff on your mind or something, you could just use some of those exercises. I just felt calmer and stuff. Another student said, I used breathing outside the classroom in my life to calm me down. If I was stressed or angry, I would then do the breathing to calm me down, and I will probably continue to do this. I was less anxious about school in general. Another student said, before you're taking a test, relax and breathe, and you don't get as nervous or as tense. And exam anxiety is a major source of anxiety for students in school settings. Another student said, I felt it was easier to calm myself if I was nervous about something, or just liked to deal with my stress. So clearly you can hear this in the experiences of the children in these studies. And we were able to get funding for one trial of yoga in a school setting. However, we were unable to get continued funding. And again, this is a recurring challenge in the field of yoga research in general, that it is difficult and challenging to get funding to conduct the research. We've also done studies on Kripalu yoga intervention in the workplace setting. This was a study we actually did in Harvard physicians. This was done at Brigham and Women's Hospital in physicians in the field of obstetrics and gynecology. And what we were looking at was burnout, which we showed positive benefit for. We saw reductions. This was a single group trial, reductions in burnout scores that were maintained at long-term follow-up. This was a 6-week yoga intervention delivered at the hospital. What we also saw was, at least at the post, a reduction in anxiety. So yoga, again, showing this change in anxiety. We also did a study in Harvard medical residents. This was a randomized controlled trial. Again, we saw improvements in total burnout scores that were maintained at the long-term follow-up, but also reductions in anxiety in the yoga group. Now, we were fortunate enough to actually develop a relationship with 2 psychologists, clinical psychologists, who were actually yoga teachers and implementing yoga with their patient populations. And in collaboration with them, we did a study. And in this case, this study combined a Kundalini yoga practice together with cognitive behavioral therapy for generalized anxiety disorder patients. And we were able to get this paper published. We showed statistically and clinically significant improvements in state and trait anxiety and even scores of panic. And working with another clinical psychologist who was using just a Kundalini Yoga intervention for her patient population, we were also able to show improvements in a number of measures of generalized anxiety disorder. Now, we were able to take this pilot data and submit a grant application to the National Center for Complementary and Integrative Health in the US, and we were very fortunate to get funded for that trial. And it's when you get funding that you are able to carry out these higher level research studies. And so this was the trial that we proposed and conducted and were funded for. This was the aim, was the efficacy of Kundalini Yoga as taught by Yogi Bhajan. The comparison groups in this trial was a 3-arm trial, was cognitive behavioral therapy and a stress education control condition. And we were the goal was to compare Kundalini Yoga and cognitive behavioral therapy in a non-inferiority test, and both of these compared to stress education in superiority tests. The plan was to enroll 230 patients with a primary DSM-5 diagnosis of generalized anxiety disorder. This was a multi-site randomized controlled trial conducted at Boston University and Massachusetts General Hospital, Harvard Medical School. We were to recruit 95 cognitive behavioral therapy and Kundalini Yoga patients and 40 stress education patients. The intervention included 2 instructors in a group format over 12 weekly 2-hour sessions. In addition, participants were to do a daily homework practice of 20 minutes. There was intensive treatment integrity and compliance monitoring throughout this trial. The outcomes were evaluated bi-weekly at end treatment and in 6-month follow-up. We had quite a few number of outcome measures in this very strong research design. And we also included a number of secondary aims and analyses, including things like mediators, moderators, and an evaluation of mechanism. And this work is still ongoing. Now, we were very fortunate to have success with this trial, and actually great success in publishing this in a major medical journal in JAMA Psychiatry, the Journal of the American Medical Association. And what you can see here is the outcomes of this trial. We successfully randomized 226 patients, 93 to yoga, 90 to CBT, and 43 to stress education. Ultimately, we had 93, 90, and 43 included in the analysis. The Kundalini Yoga was the style as taught by Yogi Bhajan. It's a popular style in the US, Europe, and South America. The daily home practice included, or the weekly sessions included discussion on compliance. The home practice session was practiced. There was discussion of philosophy and psychology, 15-minute pranayama practice, a full yoga set practice of 15 minutes, and a breathing meditation of 15 minutes for the 2-hour session. In addition, patients were to practice at home every day a 20-minute home yoga practice with an audio guide. The cognitive behavioral therapy was a standardized protocol with former treatment modules, cognitive restructuring, and all the other elements of conventional CBT. And the stress education condition was education on stress response, but no active mind-body techniques. And again, all 3 treatments had a 20-minute home practice. The yoga practice included simple loosening exercises, some spine flexes, shoulder shrugs, neck rolls, and the main intervention was an 11-minute practice of a segmented breath for anxiety, focusing on the exhale, which is known to be a ratio that induces the parasympathetic nervous system. This is the outcome that we experienced. This is the response rate. This is the rate of success of treatment. And what you can see is that the Kundalini Yoga intervention is in the orange line, cognitive behavioral therapy in blue, and stress education in the black. And cognitive behavioral therapy and stress education and cognitive behavioral therapy and Kundalini Yoga were superior to stress education at the 12-week end of treatment, and only the CBT was effective at the long term. And what you can see in comparison of Kundalini Yoga with CBT, the gold standard, is that after 6 weeks, virtually they are neck and neck. But clearly CBT remains to be the superior, but we are very encouraged by these results. This is the first rigorous trial of a yoga intervention for generalized anxiety disorder, and yet we're seeing a very strong clinical response. And so we are very encouraged by this evidence. This is the first trial, and of course, cognitive behavioral therapy has been optimized over many decades of implementation. So the fact that a yoga intervention could have this much efficacy compared to CBT is very encouraging. And future research could perhaps put together yoga plus CBT intervention to enhance outcomes. The other version of a yoga intervention is that cognitive behavioral therapy is not as widely available as yoga. So this really supports this whole idea. Now, moving to this idea of the importance of this, the fact that this was published in a very strong journal has a lot of impact. There is a metric by a company called Altimetric, which does a sort of an evaluation of different research studies and talking about the impact of how this research study has efficacy. It looks at whether this paper was referred to in news outlets, in blogs, was tweeted, or was on Facebook pages. And what you can see is that they come out with a score. This is the score for this particular paper in this strong journal, 823. And interestingly, this paper fell within the top 5% of all research output, has the greatest impact on society, and this is mediated through impact on the general population as well as through the healthcare system to clinicians, ultimately to patients. So this is really a summary of how we can see this roadmap fleshing out of bringing yoga into healthcare and into the general population. So I acknowledge all of the researchers, the many researchers that contributed to our major randomized controlled trial for generalized anxiety disorder, particularly Naomi Simon and Stefan Hoffman, and the many researchers who looked at our early research on music performance anxiety, post-traumatic stress disorder, and yoga in schools and yoga in the workplace. I also acknowledge the support of the National Center for Complementary and Integrative Health in supporting our randomized controlled trial. This was a $4 million trial that was supported by our federal government. And then Kripalu Yoga Center, which supported a lot of the research that was done on PTSD, on yoga in schools, as well as the yoga in the workplace. I also work closely with the International Association of Yoga Therapists promoting yoga therapy. I serve as the editor-in-chief of the International Journal of Yoga Therapy, and the whole idea of this organization is to really promote the implementation of yoga into healthcare. And then I also serve as the director of yoga research for the Yoga Alliance, one of the largest yoga associations in the world. My role there is yoga research literacy. We have many yoga research videos, webinars, and a collection of citations for the general population and for yoga teachers and yoga practitioners. And then I also serve as the director of research for the Kundalini Research Institute, which supports the style of yoga that I practice. And I close with a favorite image. This is semi-precious stone of a yogi embedded in the Golden Temple in Amritsar. So I thank you for your attention,